Thanks so much, Sandra. Good morning, everyone. It's good to, although I'm not physically here, but it's good to be back at Laurentian. I've missed it a lot, and I missed the people, and I certainly missed the Crosh crew. So I think it's pretty fitting that my presentation comes after Lisa's, because I think there is a little bit of overlap, especially when we start talking about solutions. So as Sandra mentioned, I'm an assistant professor at the University of Guelph in the Department of Population Medicine. And we started a new lab that I'm leading, which looks at the occupational health and wellness, all the risk factors kind of related to it. So yeah, I'm happy to share a little bit of some of the research that I've been working on, during my PhD and beyond. And I hope you enjoy it, and I'm looking forward to having some meaningful discussions afterwards. So here's a problem, and I don't think this is a shocker for many. We have some significant challenges within our healthcare system. And when I say healthcare system, I'm not specifying Ontario, although Ontario is probably my main focus for a lot of the work that we're doing. However, this can be seen nationally and arguably also internationally. What we're seeing in Canada, however, is that there are significant challenges to finding like a healthcare provider. So whether it being a GP, whether it being a physician, a nurse practitioner, this is a challenge. And these challenges are much, much worse when you think of it from a rural and a northern context. The increase in wait times, for some or many even, this was an issue that we all knew about, but for others, it might have been an issue that they didn't really realize was significant until the pandemic kind of happened. But this is something that healthcare providers have been battling for a very long time. Even just the wait from going from a practitioner to a specialist is pretty long in Canada. And finally, we are also an aging population, so we are going to get sicker. We're living longer, which is good. So medicine is clearly working. However, we are facing a lot of challenges, so we need to be prepared. And then to top it all off, COVID arrived and made things much, much more significant. And that's why you're seeing in the news all the time how people are waiting in the hallways to be seen, how even there were a couple of instances where, a patient died waiting in the hospital. So this is to say that it is a pre-pandemic problem that got worse since the pandemic. However, this is a very complex issue and it's intricate. So we can't say it's one factor. The work that I was doing, for the last few years has really shown that I can't look at just one factor. So let's look at some of my work that I've done kind of over the past, just to kind of give you a perspective. So I did some meta-analyses to look at nursing and predictors of sick leave. So I'm going to kind of talk about these one by one. So when we look at the more personal or demographic kind of variables, we find that women, unlike men, are more likely to go on sick leave. Now, you may say, how is that possible? There's a lot of research on this, and it's not always consistent. However, in a more recent study that I read, it was actually interesting to show that women have higher depression rates in the workplace. However, it's significantly reduced, I think by 36%, when you take out the family life conflicts. So this is to show that, women are carrying a lot. Perceived health rating. This may not be, completely surprising. However, it is important to recognize. So if a nurse or a healthcare provider is saying, I am not well, we need to be listening to them because it's telling us something. It's telling us that they may go on a sick leave. And then to add to that, history of sick leave. So if you've been on a disability or a sick leave in the past, you are more likely to go on another one. So in psychology, we talk about it that previous behaviors or past behaviors can predict future outcomes. Then we look at physical factors. Musculoskeletal pain was obviously the most significant one. So if you had musculoskeletal pain, you're about 2 times more likely to go on a sick leave. This gets even worse if the pain is actually just back pain. You're 3 times likely to go on a sick leave if you have back pain. And then remember what I said earlier, history of sick leave. So if you've been on a back pain, if you've had back pain, you go on sick leave, you come back, you might go on sick leave again. And through some of my other research, it actually showed it's not necessarily just because of the physical pain, some psychological issues can also develop. Speaking of psychological, when we think of psychosocial factors, those who have poor mental health outcomes like depression and anxiety are more likely to go on a sick leave. Emotional exhaustion is a strand of burnout. And we found that this strand, if you are experiencing high emotional exhaustion, you are more likely to go on sick leave or disability. For many of us who are well versed in the occupational health and all the constructs that kind of follow with that, there is this model called the job strain model or Kersak's demand control model. And what this one says is that people experience job strain if they have a highly demanding job and very little autonomy in the workplace. What my study found is it actually doesn't matter about how much control you have, whether it's high or low. It's just demand that is predictive of going on a sick leave. Because job strain, when put together in the meta-analytic work, it actually was not predictive of sick leave. High or low autonomy was not predictive of sick leave. However, high job demand was. So this is something to consider. And the perception is also very important. And then finally, for psychosocial factors, if you are perceiving the workplace as non-supportive, you're more likely to go on a sick leave. This is a very, very, very important piece for managers everywhere, whether it's healthcare or not. Because when someone goes on sick leave, it's extremely expensive. And the recruitment and retention is obviously a significant issue. When we look at more organizational factors, we find that PSWs and nursing assistants were more likely to go on sick leave than nurses. Those who are doing night shifts were at higher risk. Additionally, those who are working in psychiatric or pediatric units, we found that those were predictive of going on sick leaves, and there's lots of reasons behind that. So when I did some qualitative work in Sudbury area and sort of the surrounding area, we actually found in the qualitative work that staff shortage was the underlying factor to all the issues that could lead to sick leave. So shift work. So every time they talked about a factor, what they would say is, you know what, well, while I was working shift work, I was working a long time. And it didn't help that I was by myself instead of having, my partner who's working with me, for example. There's also anxiety. And this is actually kind of interesting because what we found is those who are off work, they're feeling anxious about, managers calling them, telling them, can you come back? So obviously this has an impact on work life and work-life boundaries, and also getting injured because you might be doing work, you might be doing the job of maybe 2 or 3 people. So you're working longer and you're working harder. So these are all pre-pandemic issues that are contributing to the staff shortage. So now that we're talking about during the pandemic, there are factors that are connected to staff shortages, whether it being sick leave, leaving the profession, and so on. So I was very privileged to have received a CIHR grant to look at occupational professions that maybe are not necessarily seen too much in the media or even in the scientific literature. I have actually my colleague, Dr. Nauruzi Kia, he was a part of this project with me. We also got funding from CROSH. So thanks to the CROSH-C grant, this was led by Dr. Judith Horrigan, and the master's student is actually leading this work at this moment. And we also got a little bit of funding from the Medical Laboratory Professionals Association of Ontario, who helped us publish some of the work that we're doing. So this is just to show you what we're working on. So some of the findings that I'm presenting to you has not been yet published. So I'm just showing you snippets here and there. There are lots of factors, just so you know, before I go into my next slides, there are lots of factors that we found that could be attributed to sick leave. However, I'm only going to show 4. And I'm also going to only show about 4 solutions. There's a lot more. This is a very complex issue. So I'm just kind of show you maybe bigger picture stuff. So the first one is fear of contagion. Now, if you notice that my heading there says newer challenges, because all these challenges were there in some respect pre-COVID. However, they're now presenting themselves in a different way. So when I was doing my research about Northern Ontario nurses before the pandemic, so just talking about sick leave and things like that, they talked about contagion quite a bit. They talked about how a nurse who basically, they call them even the dirty nurse, and they would say, this is the person who's going to gown up, is going to mask up, and is going to deal with all the highly contagious people. And that was obviously a huge fear for them. However, the fear is now different in that they're worried about themselves getting sick and spreading it to family, and spreading it to immunocompromised individuals. And with all this fear of contagion, they've now become even more isolated. This issue was much more significant in the first few waves of the pandemic, but it still lingers. So if you really think about this, working with someone who's seeing sick patients all the time, they're less likely to want to be out and socialize. Maybe some do, but for the majority, they don't. And just so as we're talking about this, I'm talking about pharmacists, I'm talking about nurses, I'm talking about medical lab professionals, I'm talking about even physiotherapists and occupational therapists. There's lots of professions that we're talking about, but this is sort of one of the main themes that emerged from all the work that we've been looking at this time. So fear of contagion is the first one. The second one is higher workload. Now, we definitely understand that healthcare providers have always been complaining, well, I shouldn't say complaining, but have been struggling with high workload. Now, things got worse because of the pandemic. Because what we're seeing is the volume has increased significantly and their resources have decreased. So if you are working in a medical lab, as an example, you're now being tasked to do more things that you weren't supposed to do. And they actually cut some of the funding. So here's a quote or an excerpt from a medical lab technologist. He said, "Our supervisors want us to increase our numbers. We're giving you everything we have." They were very, very frustrated in the focus group that we did. There's also a lot of talk, and this was primarily in the medical lab world. There are already a population that's really short-staffed to begin with, but when COVID hit, a lot of them said, you know what? I'm going to retire now. So those who were going to retire within a few years decided to take an earlier retirement. So this is contributing to a pre-existing issue. And then, you know, a lot of participants from different groups were talking about more sick leave due to COVID-19. So it's inherent. So it's almost like inevitable someone will get sick. However, when somebody gets sick, they don't want to infect others, so they have to stay home. And the same if they have a child. So childcare is also an issue. But the piece here that's really was interesting is that we found, especially with the medical lab professionals, we found that presenteeism, which is being sick and reporting to work, was a huge issue pre-COVID. One participant actually said, unless you're dying, you're expected to come to work. Taking on more duties, including different roles, was definitely something that a lot of participants have mentioned from different professions. This was a big issue, especially for pharmacists, especially during the earlier stages when physicians and other healthcare primary healthcare providers were working only from home. So one pharmacist said, "I find myself chasing doctors on a daily basis, like patients are basically harassing me for prescriptions, and now I have to go and harass their doctor for the same prescriptions. They can't find the doctors because they're not home. And because of, you know, there's no secure sort of medical records yet that is sort of intuitive and connected with other healthcare professionals, fax machines still is one of the main sources of communication between healthcare providers and pharmacists. So it was an absolute disaster. And some physicians are actually still working from home. So this continues to be an issue. However, it's obviously has resolved a little bit since. Moral distress. So this is an area that I'm actually looking to delve into a lot more, especially in my role, because I also look at veterinary health, and this is a big issue there. So again, moral distress is not necessarily a new concept in healthcare. However, we saw it in two different ways with the pandemic context. So not working equals compromising patient care and leaving staff short. Leaving staff short. So one MLT said, I have to keep doing various roles and help out wherever I can, because if I don't help out, then patient care suffers. So I'll put them before my own needs. So it's all push yourself to the max. Who cares about your mental health? Who cares about your family life? You need to do this for other people and put yourself aside. This is a very powerful excerpt, as you can see. And there's almost this guilt of taking time off. And as Lisa Belanger mentioned, how can you basically be able to work if you can't recover from previous work? Also, this is actually more nursing specific, but they found that restricting visitors from dying people is a nightmare. And I could only imagine right now someone who's very ill and they're seen as the gatekeepers. And I can't even imagine. Anecdotally, actually, I can say my dad was going through cancer last year. He's all cured now. And his English isn't the best. And I just wanted to go with him in order to help him make sure that, he knows where to go and things like that. And they wouldn't let me. And then I started crying. And then the person who was actually telling me this stuff, he started crying. So it must have been really hard on them. I'm just one person. Imagine going through this every day. Feeling unappreciated. This is a huge problem in healthcare. And it's, and the idea of feeling unappreciated can be seen in different ways. For some professions, like medical laboratory professionals, for many of us, we probably didn't even know who they are until the pandemic happened. In fact, for still some people may not realize the work that they do. So they feel that their work is going unrecognized. Maybe some other healthcare, so we keep saying thank you to the doctors. And hey, I can't thank doctors enough for all the work that they do. However, there is kind of that inequality of how people are being praised. It is difficult to praise every profession. However, if you're in a profession where you feel like you're giving it your all every single day and no one is even saying thank you to you or even recognize the work that you do, that could be really, really stressful and can just lead to burnout. Also, dealing with the public's views and perception has been a huge issue. So one example is pharmacists. Pharmacists continue to be seen as retailers, not as healthcare providers. And during the beginning of the pandemic, there was a huge issue with personal protective equipment and finding them. And when pharmacists would find them, the cost was significant. So something that would cost $10, for example, was now $30. So even if they sold things at cost, it was still really expensive. However, the public would see it as, oh, this person is price gouging. So there are a lot of pharmacists that actually either stop selling personal protective equipment, or they sold it at a loss just so they don't get blamed. What we're seeing is a lot of people that want to leave the profession, actually, in all the professions that we've interviewed. So one pharmacist said, as much as I enjoy dealing with some of the patients that I deal with, being very heavily involved in their care, I do not appreciate how I'm being treated overall. And this person actually said, I'm thinking of changing my job. Or like my career. Pharmacy technicians, same thing. And they also talked about how they weren't even considered for COVID pay. So some professions got COVID pay and others didn't. Nurse, this really resonated with me. So this person said, I used to love nursing. The pandemic just pushed it over the edge and showed me that hospitals truly don't care about their staff. I will be leaving hospital nursing within a year. And if I had the option, I would leave nursing as a whole career. Medical lab professionals. The lack of understanding about lab is incredible. Since we're behind the scenes, we're this magical place where specimens get sent and information comes back. So here's sort of the framework or the model that I believe is contributing to staff shortage. It actually starts with staff shortage because that's what we're facing now. And then there are these sort of level 2 sort of traceable variables where they're not actually the things that lead to it, but if you're having a little bit of mental health, if you're having issues at home, if you're having occupational stressors, if you're working shift work, all these factors kind of are combined, but we don't say, oh, you're doing shift work, that means that you're going on sick leave. So this is sort of the antecedent after the antecedent. And then the detectable variables is when someone is actually saying, I have musculoskeletal pain, or I am going through burnout, or I have a mental disorder to which I can't do my work. So what then happens? These people go on a leave. And guess what? We have more staff shortage. So it becomes a very cyclical issue. And then I believe that this work is obviously moderated by increased work demand due to pre-existing issues, along with COVID-specific factors. So these are the indirect ways of where we see staff shortage happening in healthcare. So now what? So some aspects of healthcare cannot change. I can't do anything, but we can't necessarily say give people more money. That would be good. I do think people need to be compensated fairly. However, there are other things that require change with an emphasis on prevention. And as I mentioned before, the work that Lisa Belanger mentioned kind of goes nicely with what I'm about to show. So let's talk about, I talked about 4 problems, I have 4 solutions. Improved communication and work support is huge. This is something that I've been talking about for a very, very long time. And when things were happening with COVID, I was just almost pulling my hair saying, like, people, listen, leadership training. We need to be better leaders. If we're better leaders in the workplace, we can help to problem solve. When I was talking to nurses in the past, they said, you can get punched in the face by a patient. And yes, you might report it, but there's really no regular debrief. Again, maybe some places are better than others, but this is an important thing to remember. We need to improve the workplace culture because here, guess what? If you're in a supportive work environment, you are statistically much less likely to go on a sick leave. Empathy versus sympathy. I won't go in too much about that, but this is something that's really, really important. Being empathic. You don't need to tell someone, sorry you feel that way. A better answer is like, I can't imagine what you might be going through right now. Listening to people. You don't need to fix people's problems. And when it comes to improving the perception, so if you have a perceived high workload in your workplace, don't just try as a manager, or as a manager, we shouldn't just try to fix the problem. It's actually listen to what they have to say. I truly believe that we need to have better wellness classes and wellness education in the curriculum. So whether you're a nurse, medical lab, pharmacist, and so on, we do this with veterinary students. So I actually teach communication and wellness for veterinary students, and it really, really helps. We need to give them capacity to become resilient. We also need, from a regional, provincial, and a national level, to give more awareness of the various roles that healthcare providers offer. This is really important just to give some closure to people who feel that they don't get any recognition. And then finally, we need to have better healthcare integration. So as you may know, pharmacists can now prescribe for minor ailments. I think this is a really good thing. However, we need to build a better infrastructure for them because a lot of them are in retail. They're tasked to do a lot of administrative stuff. And then what ends up happening is they're not doing as much clinical work. And obviously having digital records that can speak to one healthcare provider to another is really helpful. So this is my presentation. Thank you for listening. I am, and I spoke to Toby about this to make sure that it's okay. I am recruiting one PhD student in the fall. And if anybody's interested to chat some more about this, please feel free to contact me. And I'm in the Department of Population Medicine. So thank you for your time, and I'm happy to answer some questions.
Great presentation, Baz. Really powerful. Okay, we only have about 3 minutes, so I'll give you your first question here. Do you expect that Canada will possibly introduce accelerated programs so that students can study medicine faster, owing to the shortage of specialists and medical staff in general?
Yes, it's already happening at Queen's. So Queen's is allowing for a slightly accelerated program for being a GP, like a family doctor. And I think with that, there needs to be a focus on people who are maybe international. So one issue that I'm seeing, and this is actually anecdotal, my dad is a pharmacist, or was a pharmacist back home. When he came here, he didn't get any support to practice pharmacy, so he didn't. If there were better ways to help healthcare providers coming from a different country to be regulated quicker, or at least ensure that they are on track to become good, to be a professional or be regulated here, that's huge. Because again, a lot of the application is like, what would make you come to Canada? And they said, okay, well, I'm a pharmacist. So they say, oh, great, we need more of you. And then we come, and then there's no support. So there needs to be more support for that, absolutely.